without reservation, go and see PracticeMatch. This is not a one-size-fits-all. And there are some very good companies out there, but year in and year out, with me looking at the data, what everybody is good for, what fits us as a system, PracticeMatch rises to the top. It's a winner every year. I know the other companies continue to contact me. If PracticeMatch didn't exist, I might go to them, but unfortunately for them, PracticeMatch does exist. I'm Philip Wallace. I'm the Senior Physician Recruiter for Baptist Health in Arkansas. I'd have to check for the exact date, but I believe it was 1995 we engaged the services of PracticeMatch. And after attending a few conferences, I met some of the people from PracticeMatch, had been to the conventions where you saw all of the other vendors that were there. The individuals that were there at the time were very friendly, and I thought, okay, I'll give these guys a chance. And here we are 30-something years later. For me, it's my physician FBI database. I can go in there and find exactly what I need and not waste a lot of time with that. It's pretty seamless as far as going in there and finding the things that I need to connect with that are going to hit on all the cylinders for a physician opening. A lot of hospital systems use outside firms. We pride ourselves in not using outside firms. We do the recruiting in-house. And our main tool and main point of attack is using PracticeMatch with its database. Just this past few months, critical care medicine. Crisis ensued where, with us having the largest ICU in the state of Arkansas, it was determined that we needed to hire 7 or 8 more critical care medicine physicians immediately. They're not out there hanging on trees. They're not low fruit to be had somewhere. And the only way we were going to find that was to have a direct intervention with a database that was going to be able to reach exactly what we were looking for. Neurocritical care, pulmonary critical care, general surgery critical care. And PracticeMatch came through with over 24 qualified candidates with that. We got double-digit interviews, and we have offers and acceptances out there from 7 physicians just from this one campaign. That's astounding. Cost savings for the system. And according to our boss, who told us in an email to our president recently, my partner and I saved the Baptist system over $2.5 million in placements in the last year and a half that would have gone to companies had we had to use them outside. But the majority of that coming from PracticeMatch and putting a stopgap on that. I think the staff has a lot to do with it. They're very engaging. You're not afraid to tell us if we need some help on something or maybe try this. Back to COVID, I probably talked to PracticeMatch every other day during that time period. I was covering the 11 hospitals and 100+ clinics by myself. I don't think many days would pass that I wasn't on the phone with someone with PracticeMatch saying, let's try this, let's try that, and the candidates just kept coming. They kept coming, and we were very successful during an incredibly awful time in the United States. And I look back now and I still see all of those physicians' faces that came out of that big push. We had just started residencies of our own, and more than half of that faculty came out of that campaign that came into existence during COVID. I'm glad we've had a long relationship. It's a professional marriage that I would probably do again.